right, another day, another book to bring into your awareness. This, mental health care practitioners, I'm looking at you with this one. Everybody, but especially you. That is Susanah Cahalan's Brain on Fire. Also, support your local library. This book is a memoir. Cahalan was in her 20s when, for about a month in her life, she descended into what appeared like madness, psychosis. She had changes in her behavior, in her memory. She became different. And what I think is really interesting about this book, as I was reading it over and over and over again, there was a prevalent message about, oh God, please don't let this be mental illness. And I couldn't help but keep that message, or that message, let's say, reverberated in the back of my mind as I was reading, because I think it speaks to the fear of major mental health crises, the fear of having one, the fear of watching one. She, for example, got paranoid as heck, and I should say she is a journalist. She was a journalist, and admittedly, as a writer, that cognitive skill set, that ability to write and to language her experience, really helps the reader here be with the story, in addition to the emotion, in addition to the details, which later in the book we learn that there was not mental illness, but I'll get there. Cahalan talks about the paranoia. There's a really powerful passage where she is saying, they're kidnapping me, call the police, they're taking me against my will. She screamed at the Middle Eastern cab driver. He looked back in his rearview mirror but did not drive. Let me go, I'm calling the cops. Get out, leave car, now, the driver said. Imagine being a woman in New York City, young woman experiencing these symptoms of paranoia. She is admitted into a hospital and they put all sorts of tests on her. And ultimately, it is a spinal tap that shows elevated antibody levels, and a top shelf doctor who puts the pieces together and recognizes that what she has is actually a very rare biology-based disorder, anti-NMDA receptor autoimmune encephalitis. So her brain is attacking itself. And what I think is so powerful about this book, why I think that it's very important for mental health care professionals to read, is because this underscores the fact that there's really no biological basis for mental illness, and that most patients are going to get the pass. Symptoms can present, and symptoms are only the smoke. The fire is what we need to determine to know how to put it out. And I think any psychological diagnoses, any psychiatrist who is about to consider or prescribe, well, I want to say psychotropics, but any medication that's going to alter the brain chemistry really needs to look at biomarkers and spinal taps for all, y'all. Because in this case, while Susanah was presenting with what might have otherwise been diagnosed as schizophrenia, once the biological basis was addressed, her symptoms went away. She was on antipsychotics during the episodes, was taken off of them. She made a full recovery through steroids and IVIG antibodies to treat the encephalitis in her brain. I think that while there's it's almost like a side job, right, to deconstruct the DSM and come at psychiatry, patient-centered voices are really important. And ultimately, we have to ask ourselves what that body do. What is the body doing? Cahalan notes that in the end of this work, she wonders loudly how many people are misdiagnosed with schizophrenia or autism, when in fact it is encephalitis. There is a trend, or at least a running conversation, I think, about the prevalence of mental disorders and how the prevalence has increased over the past few years. I don't necessarily think that they've increased per se. We're just calling them something. What the DSM does well, it gives us containers, it gives us buckets to look at personality patterns, constellations of behavioral patterns, constellations of symptoms. But what it doesn't tell us is why. And also, it's written by people who probably didn't have the disorder in the first place. Again, that is not to discredit psychiatrists, any mental health care practitioners. I'm also speaking to you. What that means and why I think this book is so powerful is that it offers us the opportunity to question. It offers us the opportunity to think in a different way. Why is this person behaving like this? What is the mind doing, but also what is the body doing? And it's an invitation to create a team to treat your experience. So that could look like getting blood panels done. That could look like many different biological tests or biotests. I feel like that's not the best word, but I'm just trying to say more than a question and answer test. And if you're working with a patient, when I'm working with students, I encourage health as a foundation, physical health as a foundation to the mental health. So it's not just advocacy. Ask questions, go to the doctor, right? It's advocating for a bigger picture. It's advocating for treatment. Some of these really strong psychiatric illnesses, like bipolar disorder, someone was asking me the other day, does it go into remission? It gets manageable. Does someone have this NDMA, encephalitis? Oh, it's a mouthful. With this particular disease or disorder, not everyone recovers 100% like Cahalan did, but you recover. Schizophrenia, borderline. You can manage the disorder to get to a level that, through your self-defined goals of recovery, where it doesn't govern your life. And most importantly, that your sense of self comes back. And you know what? Maybe if you've had a disorder like bipolar disorder or like schizophrenia, maybe you're not even sure what your sense of self is, because the disorder has eclipsed your understanding of who you are. Okay? But you're there. You're under it. You're in it. You're there somewhere. Mental health care practitioners, your patients are there within it. By understanding what the body is doing, we can then better self-define, self-regulate, and guide others to self-define and self-regulate. But it takes thinking outside of just the channels of the mental health care system. It takes thinking holistically to integrate other doctors, other types of doctors. Don't even get me started on treatment-resistant, like depression, treatment-resistant XYZ, because we're not treating for the root, the cause. We don't know what we're treating until we look at some of the biomarkers, until we look at some of these other diagnostic tests. And you just keep going until you find doctors who will work with you to achieve health. Keep advocating for yourself to achieve health. Look, she's a white girl. She grew up in Summit. I grew up in North Jersey. You know, we know. Folks around Summit, they had cash. She went to an NYU affiliated medical center. All of the top shelf things, all of the access and privilege that many others don't have. But she sets an excellent precedent. So let's run with that. Brain on Fire, Susanah Cahalan. read her journey of how she did it, and then we can start brainstorming how we do it for you, and also how we support others to do this for themselves.